Girl, you've got questions. Questions about your body and how to feel good in it, about your hormones and how to keep them in check. Questions about your sex life and your whole health. Can you imagine having a best girlfriend who was also a triple board certified OBGYN? A girlfriend doctor you could call and ask or tell her anything. Someone who could show you how to live any stage of life, before, during, or after menopause, in a big, bold, and beautiful way. Well, friends, I'm your girlfriend doctor. I believe you are meant to flourish and shine, to embrace life and awaken to all its possibilities. Let's get there together. Welcome to our show. Welcome to the Girlfriend Doctor Show, everyone. Today I've got something special for you. We're going to talk about female sexual pleasure, and it doesn't matter how old we are, what stage of life we're in, and beyond, and give you some great tips on maybe achieving that elusive orgasm more intensely than ever before. So I'm thrilled to be here with you. And on the couch today, virtually, we have Marielle Elzea, who is with us here from beautiful land in Colorado, Loveland, Colorado, and I'm thrilled to have her as she is a female sexual pleasure expert. Yes, well, welcome, Debbie. Good to have you here.
Thank you so much, Dr. Anna, and thank you so much to your viewers and listeners out there. I'm delighted to be here.
Well, we're going to get right into it. And one thing that you always say, Debbie, is that female sexual pleasure is an art, a skill, and a science. So let's talk about that and how it all works together.
Sure. Yeah. Female sexuality it can be complex. And if it's not working to your dream and what you expect, you're not broken. It's just that there's a lot of components to it. And one is, the science of it. And it's the anatomy that we have innies rather than a man's outie. And that our female parts actually are homologous and correspond to the male parts at early stages in development as fetuses. They're the same, and then they branch into the same. So there's a lot of knowledge to be involved in the science. And also female sexual pleasure it's something that has not really been very well studied until recently. And that is, for instance, men have walked on the moon for 30 years before the actual clitoral network was mapped. And it was understood that the clitoris is not like little bean-like structure, but is instead, that is just the tip of the iceberg with as much erectile tissue as a man has, but 90% of it under the surface. So understanding the science is really important. And then there's also the issue of hormones.
That is so true. And the clitoris in itself is several centimeters long, as well as contains over 9,000 nerve endings. I mean, it is a pleasure zone. It is one of the many erogenous zones of our body, and should not be underestimated.
Exactly. And then, of course, your expertise falls under hormones. So there's the science of the hormones, which so impact our mood and our desire. And it means it's cyclical over not only the course of the month, but over the course of our lifetime. Especially now we are in the menopause era, and our sex drive, our libido does typically fall off, but that is also healthy and normal. But that doesn't mean that we don't fight for our sexuality. We still got an average of 30 more juicy years left after menopause, and we don't want to give up that sexy time in our lives. And so that's an emphasis too for both you and me, which is how to keep things sexy, even when hormones start to drop off there.
And that's so important. I mean, this is a second career for you, right? You entered this path because you yourself struggled. You hit menopause, met the love of your life, and then what?
So I was in, I was an attorney, and I was in the IT field, and I was in a sexless marriage for about 10 years, and his choice, it being sexless, was definitely his choice. And then, got divorced, was a single mom. And then I finally meet the love of my life, who is my husband, David. And I'm so attracted to him. And then I hit menopause, practically on my wedding day and like so many of us, my organic desire just fell off a cliff, and a lot of my responses and things. And I said, oh, hell no, I am not going to let this happen. So I started doing, research into this. We started taking up sacred sexuality together. And I got inspired to pursue my passion project, which is helping other women to have not just beautiful sex lives physically, but to have the emotional connected sex lives that they desire. And I learned that there's something called sex coaching. And I invested a lot in learning how to be both a life coach and a embodied sexuality specialist, so that I could help people to, keep their relationships great, stay together, don't break up and, harm your kids. Let's stay together and rock each other's world, because talk is overrated in many ways, right? Conversation. And I think a lot of couples, if they could get the sex and intimacy part of their love life right, then they'll find so much more happiness together. So that was my inspiration, was my own menopause. And I love sex. I love sex with my husband, but it is different after this state. And so we'll talk as much as we can in this little brief time we have together about making sex connected and beautiful and enjoyable, even though, it does change with the stage of life.
It absolutely does change, of course, with our hormones, but it can be really, once you tap into that energy of sex, right? Enough of the sport sex, right? That's, enough of the sport sex. And I love to talk, and I teach this in Sexual CPR, my program, about energetic sex, right? Really tapping into the energy of sex where, two bodies become as if one. And it's an energetic connection that you can really tap into as you deepen your intimacy and your connection with your partner. And I think this is really special because we do, like you mentioned, years of a sexless marriage. I entered this realm of sexual health as well from my own personal struggles too, as well as thousands and thousands of patients that I've helped. And so, being able to revive a sexless marriage and understanding what went wrong and really understanding your own pleasure and tapping into your own pleasure. I always tell women that how can you expect him to please you if you don't know what pleases you? And I think that's just that really is like part of the foundation. So let's talk about reinvigorating our sex life. What are some steps that we can take to reinvigorate the sex life so that we do, either stay at a high level of intimacy or revive that intimacy?
Yeah, now you're talking about the art. So we briefly talked about the science, having to do with the anatomy, the hormones, the female brain. And now you're talking about the art, which is what does this particular female need to not only feel physical pleasure, but to feel emotional connected and to get our needs met. And we often have these emotional ideas in our minds that we really want met. And it might be that we want to feel cherished and desired, but it also might mean we want to feel playful or naughty or any number of things. Every woman is different. So that is the art, is exploring what it is that you want to feel from making love. And I really prefer the term making love whenever possible. What is it that you want to feel out of making love? And what are the themes and the scenarios and the types of touch and the types of connection and stimulation that it takes to get you there? And that is largely the art. And also why it is a learned skill, because how do you know these things if you haven't thought about it? And if you haven't practiced it and practiced asking from your partner what you want in a way that feels like we're sexual explorers, or we're doing this out of love rather than feeling like it's criticism. So that's also an art, how to get what you want from your partner in a way that is connecting and not criticizing.
So give us three tips on that, 3 tips to reinvigorate the sex life.
So bodies go numb from lack of touch or from trauma, if you have a history of trauma and things like that. So one of the first things would be, how do you reinvigorate your senses? And senses don't, mean just going straight for the genitals, but, how can you start with mindful touch and really increase your sensitivity to energy. Like you mentioned, I love the topic of energetic sex. My husband can make me scream with just his eyes. He doesn't even need to touch me. That's how energetically in tuned we are together. So thinking of different ways to look at orgasm and sexual pleasure rather than just like being very goal oriented. So one would be embodiment. Increase your embodiment and your sensitivity to energy and to touch through mindful touch practices. Anything that also will help get you out of your head and into your five senses is important too. So that might be savoring, savoring the sensual practices in life, noticing and paying attention, because even though most of us are encouraged to be in our busy minds, like in our jobs require us to be in our minds all day long, sexual pleasure takes place in the body. So helping to focus on, bodily sensations, sight, touch, taste, smell, are all going to increase your pleasure. And also a mindful self-touch practice. So, getting, especially if you're reinvigorating and you haven't been active lovemaking for some time, you might examine why. Is it the quality of my relationship? Is it kind of fear or trauma or insecurity? Get to the root potentially in therapy or working with a coach of why you've not been enjoying sex. Maybe it's just you haven't been getting the kind of sex that turns you on, that you like, and you have to explore that way. But it could also be that, the numbness and you need to increase your sensitivity. So there's many things. Like I said, female sexuality is complicated. It doesn't mean you're broken, but it does mean you may need to invest time and effort and even money into your sex life like you would for your career or your education or your fitness. Sexual fitness is something that if you want to keep it, is something to invest in, and you can create the magical sex life you desire, and your partner will be equally thrilled when your desire and your interest comes back.
Right. And I love this concept of female sexual, our female sexuality, and really understanding what does feel good to us and being able to communicate with that with our partner. And I know the sexless marriage, there's two people in this equation. We have a couple episodes coming up with Dr. Jeffry Life, and we're going to be talking about men's sexual health, their desire, as well as erectile dysfunction issues and how to speak with it. Debbie, I want to thank you. And also we have a special segment, Uncensored, in the Girlfriend Doctor Club for our audience with Debbie talking about enhancing the female orgasm. So really, no matter how old we are, we want to tap into the female orgasm and make it stronger and more vibrant and more energetic. It's not something we have to give up with age. Debbie, I want to thank you for being here for our audience. Check out Debbie and her coaching at moreintimacy.net. Moreintimacy.net. Thanks for being with us today, Debbie.
Thank you.
Welcome everyone to the Girlfriend Doctor Show. I'm really excited about this episode because there is so much that we have to talk about when it comes to men's sexual health, and it really is a tender issue. I mean, from the point of when a woman and a man are dealing with this drop-off in intimacy, a decrease in sexual function, from how do we deal with that? How do we approach it with each other? That's an issue, right? And how do we restore sexual function and intimacy? So today we're going to be talking about men's sexual health. I ask you all the time, you know that you can ask or tell me anything. Well, one of our girlfriends and our members in our Girlfriend Doctor Club posted in our clubhouse, beautiful, brave Lois, and she says, Dr. Anna, you say that I can ask and tell you anything, so here goes. She goes, first of all, now that my lady parts have rejoined the happiness it deserves, and our intimacy, her and her husband's intimacy, has improved 100%. Like, thank you, Jolva, right? Very, real good there. She goes, this is a question about his male parts. Years ago, we tried the blue pill, and while it worked sufficiently, it bothered him enough to not really want to use it. And I agree. My husband is 61 and in excellent health. He could lose a few pounds, but we are working on that too. what our main hope is to find a more natural way to improve his, may I say it, erection. She says he does have the typical prostate stuff going on for a man of his age, so I'm sure that is the main culprit. She goes, all right, I put it out there. Man, that took courage and vulnerability, but he was all in for asking for a solution. So this is an issue that affects many, many couples and certainly many marriages and can lead to a drop of intimacy. So to address this really tender issue and male sexual function, I have a dear friend, a longtime colleague, a gentleman I met in early 2000 who is literally a billboard sensation. I'm telling you, he has broken all stereotypes when it comes to regenerative medicine. He's been a leader in anti-aging medicine and on the forefront of men's sexual health on cover of men's magazines, and also 3 times New York Times best-selling author, Dr. Jeffry Life. He is known in his before and after photos. You may have seen him in his mid-50s at age 57. We'll share this picture up of Jeff, and we lovingly say he was a heart attack waiting to happen. He wholeheartedly agrees. He had diabetes, was short of breath walking up a flight of stairs, and as a physician and an expert in his field, he's like, I can't live this way. And now you see him in his 80s, just looking amazing, looking awesome, and setting a very high bar for all men out there. You guys, bring in your guy. Bring him in now, pen, paper handy. You want to take notes. You want to listen to this conversation. Welcome, Dr. Jeffry Life. Good to have you here on my couch virtually. I wish we were in person. Good to see you.
Thank you, Anna. Great to be here. Always great seeing you.
Well, I know you deal with this, and you've dealt with men's sexual health for decades. And this issue that Lois writes in about, her and her husband having issues with sexual function, erectile function. From a men's perspective, I mean, there is so much that we can do about it, correct?
Well, there is a lot you can do about it. And this happens not only to 60-year-olds and 70 and 80-year-olds, but it also happens to 30-year-olds. Probably some 20-year-olds as well. And, the first thing that I always think about when someone develops ED is vascular disease. So the absolute first thing that needs to be ruled out is blood vessel disease, because, the arteries to the penis are small arteries, and they get blocked up before the arteries to the heart and brain get blocked up from atherosclerosis. So ED can be a precursor to a heart attack and stroke down the road 5 to 10 years later.
I think that's a really important point to emphasize, because erectile dysfunction is a symptom often of vascular disease, heart disease, diabetes. It's a symptom. And so not to just give Viagra, right?
Well, yeah, Viagra or the other ED drugs, Cialis, I like that. But first, you got to be sure that this is not a result of vascular disease. So you need to make really sure that you don't have ongoing evidence that you're headed down this path of a heart attack or stroke, which, by the way, kills more men and women in this country than any other disease. So it's a huge problem. And so ED can be the first warning sign.
So when you say look for vascular disease, ultrasound, lab work.
Well, yeah. The problem with vascular disease in America is we basically have a wait until something bad happens. And so what I do, and what a lot of people that do what I do are all about, is detecting vascular disease early and then stepping in and doing a lot of things to change that course. And that's really what the central part of my practice is all about. And I'm living proof that it can be changed, because when I was, as Anna was saying, early on in my mid to late 50s, I was in horrible shape. And I ended up having vascular disease. I had heart disease. And I've been able to turn this all around through lifestyle and through the right supplements and, in some cases, prescription drugs.
So step number one with erectile dysfunction, and again, you are a role model and such an expert in this area. So step number one, rule out vascular disease.
Correct. And then once that's ruled out, then Viagra is a really good drug. I think Cialis actually does a better job. It's longer lasting, and you can actually take Cialis, low dose Cialis, every day, which will improve the blood supply to your penis, but also to everywhere else in your body, to your brain and your heart. And so I think it's a win-win across the board.
About low dose Cialis, that's the 5 milligram daily dose?
Well, that comes in 2.5 or 5. I think 5 is the optimal low dose way to do this. Mm-hmm. And then you can always up that dose if you know you're going to be sexually active 2 or 3 hours later, So it's an amazing drug.
So besides, like, when you were 57 and you're like, okay, I'm going to turn this around, I'm having vascular disease, sexual health issues, the pre-diabetes or early diabetes, what were your steps and what do you now do with your patients?
Well, my blood pressure was high. So I've worked hard to get my blood pressure down. That has actually required medication as well. Blood pressures in the morning for men and women should be in the 110s, over the 70s, or even upper 60s. And it's really important that people manage their blood pressures well. It's a silent killer. It's a silent cause of ED. It's a silent cause of heart attacks and strokes. And so people need to know what their blood pressures are. And the best time is in the morning when you get up, you sit down and you relax for 5 minutes, and then you get your blood pressure checked.
Yeah, I agree. And so optimizing that. And then you went on a physical fitness regimen. Certainly nutrition is huge in your practice. That's one of the tenets. Nutrition, exercise, and hormones are some 3 core philosophies, as well as supplementation. We'll talk about that in a minute. You went on to win the Body for Life competition.
I did that at the age just before I turned 60, and that just really changed my life. I transformed myself from this fat guy to a really fit, lean guy. It took me about 9 months, and I've been able to keep it that way, but it's always a struggle, being on an exercise program, consistent exercise program and eating program requires a lot of discipline. And so I teach my patients what to do if they get off track and how to get back on track really fast. So exercise is a crucial part of avoiding ED or getting on top of ED and returning your function. And it's a combination of resistance training, which is lifting weights, and then cardio, which is getting your heart rate up to a level that really exercises your heart and lungs. And people need to get at least 150 minutes of cardio in a week. And then weightlifting can be an hour, maybe 3 or 4 times a week. And that's what I do. That's what I've been doing since I was in my late 50s. And it really works.
Yeah, and a good example of that. And I remember in one of our earlier conversations, and I think we have a special with you in men's sexual health in our sexual CPR program. And I believe you told me that you'll get on your bike and watch the latest episode of a movie that you just love, and you won't watch it unless you're riding your bike.
That's how I've been able to keep consistent with my cardio.
I love that.
I learned a long time ago that if I watch an action DVD, that it takes my mind off how many hills I have to go through on my exercise bike. So I watch action DVDs. I download the whole season And each of these is 45 minutes long, almost always. And so I ride my bike for 45 minutes and I add a 5-minute cool down. And that's an easy way to get in 150 minutes a week of cardio.
Mm-hmm.
And it's really, I'm alive today because of my exercise bicycle.
And all of that, yeah, and your weight-bearing exercises, your muscle, really focusing on pushing your strength exercises as well.
That's right. Resistance training is really important. People, men and women, will lose muscle mass as they age. And that actually has a term called sarcopenia, a medical term. And there are a lot of scientists that believe sarcopenia is an absolute. You can't avoid it. And that's absolutely not true. So I have been able to maintain or actually increase my muscle mass as I've gotten older. And today at age 82, I have as much muscle mass or a little more than I had when I was in my 60s and 50s. And I have a whole lot more muscle mass than I had when I was in my 30s and 40s. And my strength has not gone down either. And so people must do strength training as they age. The older you get, the more important it is that you do these. The right amount of cardio and the right amount of strength training.
I agree. And sometimes a friend told me once, you've got to earn your walks in your yoga class. You've got to lift some weights, do some squats, pick up some. And back in the Navy, when I used to work there, they called it pumping pig because the old weights were pig iron, right? So you have to do that. And the other thing you always say, so we're going to focus on nutrition. Our audience knows keto green for men, keto green for women. You're a big proponent of very healthy, balanced, low carbohydrate, healthy, high quality protein, healthy fat diet for men. And then they're going to weight bear, strength train, and do their cardio. And they are going to rule out cardiovascular disease, get this optimized. And one thing you always say too is a flexible man is a sexual man. And I said that to a friend the other day and he goes, do you mean a rigid man is a sexual man? I'm like, no.
And I learned that from my Pilates instructor. I saw her doing in another adjoining room from the gym. I saw her putting one of her clients through exercises that on these machines. And I thought, I wonder what this is all about. So after she finished, I asked her, and she told me this is Pilates, started by Joseph Pilates back in the early 1900s. She said, why don't you come in tomorrow, Dr. Life, and I'll give you a free lesson. So I showed up, and she starts putting me through all these different things, and it was all about stretching and flexibility. And I said, this is really about stretching and flexibility. And she says, that's absolutely right. She said, Dr. Life, a flexible man is a sexual man.
She had you for life at that point.
I signed up and I've been doing Pilates ever since.
I love that. All right. So we're going to write, you're a physician and your patient comes in, 61-year-old spouse of our dear friend Lois, and we've ruled out cardiovascular disease, optimized his blood pressure. He's doing keto green. He's losing weight. We've got him in the gym. Now, what are you going to prescribe? Looking at his hormones and supplements. What's on that prescription pad?
His testosterone level is probably declining. Men's testosterone level gradually declines starting about age 35. And so they go through andropause, which is different than menopause. It's the same outcome, but menopause happens pretty abruptly. And women can, as you all know, can tell you almost to the month when the change started. Well, with andropause, it creeps into a guy's life. It's very insidious and very subtle. And they start noticing that they're gaining fat, a lot of belly fat. They start noticing that their sex drive is declining. They start noticing problems like ED. They just can't get it up like they used to. And they think this is because of their age. And they'll go to their doctor and they'll say, and the patient will say, I really would like to know what my testosterone level is. I've heard that low T can cause all this. And so the doctor, in some cases reluctantly, will order a blood test. And that test will come back. And the doctor will say, well, Joe, your test is normal. You are normal. But what the
Do we want
doctor
to be
doesn't
normal?
tell him
No.
is that he's a D student when it comes to his testosterone level. Maybe a D minus student.
Mm-hmm.
Now, who wants to go through their life being a D or D minus student? So if this particular patient were to go on testosterone and get his level up to where it should be, like in the upper, close to 1,000, 800, 900, it would completely change everything for him. He would enjoy exercising. He would be back to having a strong libido. His erectile performance would improve dramatically. His sense of well-being would come back, and it changes everything. And that's a big part of what I do. And more doctors are doing this, but it's taken 15 or 20 years before the medical profession has begun to accept this as a proper way to care for their aging male population.
You have an age limit on that? Do you have an age limit where you're like, nope, you don't get testosterone?
No age limit.
And I want to say too, with you emphasize the 800, 900, up to 1,000 range versus 1,200, 1,300, 1,800 that some clinics are pushing their clients towards. And I'm at that 600 to 900 optimal range, depending on where that testosterone's going. And I think it's important to look at, because it will convert to estrogen, convert to dihydrotestosterone. So keeping that healthy testosterone level, I agree, is paramount for well-being. And also recognizing, though, physiology drives behavior. Testosterone can cause increase in dopamine-seeking or novelty-seeking behaviors if it's too high, as well as agitation and angry. So we don't want affairs. We don't want fights. We want loving, healthy, happy men.
Exactly.
So we're going to prescribe some testosterone. Typically, are you doing injections?
That's what I do. I do injections. I think that's far superior to creams and gels and patches and also pellets. I have my patients inject once or twice a week, and it just works well. We get the level up to where it should be. And I don't shoot for a certain number. I really go by how they're feeling. And men with low testosterone levels, like in the 200s or even hundreds or even low 300s, will improve dramatically with testosterone injections. It's dramatic.
Yes.
And it just changes their lives almost within a week or two. And then I continue to monitor them on a regular basis to make sure that their levels are where I want them. And that's a big part of what I do. And, there's really a huge benefits to this. First of all, it reduces men's risk for prostate cancer. Reduces. Does not increase the risk for prostate cancer. Secondly, it reduces men's risk for heart attack or stroke. Does not increase their risk for a heart attack or stroke. And so we've learned this over the last 10 to 15 years. Healthy testosterone levels are important for healthy aging and for avoiding all of the age-related diseases. And so it's a win-win. It truly is. One of the few things that it's a win-win.
I agree 100%, and you do it in a very logical way. I appreciate that. We're going to come right back and talk about premature ejaculation. So I want to hit this topic with you. And as we wrapped up erectile dysfunction, I think there are so many things. So we have the testosterone, the exercise, right? The cardio, all of that it can turn around. We can just level that up and see an improvement in erectile dysfunction. Now I've used, and we have some men's sexual health packets. Really, it's heart health packets, because help the heart, help the vascular, help the blood, your vascular system, you're helping the penis, to be honest, right? Help the heart, help the penis. It's all connected. Yeah. So we've got that there. And with that, we use some supplement like our Mighty Maca Plus, so that, support the adrenal glands and support detox in our body. So that's part of my triad. Arginine, or to increase nitric oxide naturally, just like Cialis is doing or Viagra is doing. And then just a good multivitamin with methylated B vitamins, and how beneficial that is. And if we need to, we'll add additional DHEA as well. I like to add DHEA in my guys too, because that will also naturally convert to testosterone and have other benefits as well. So those are additional things that I do with men for sexual health. And I know you're on board with that, and I appreciate it. For our audience, you guys, Dr. Life is still practicing. He's in his 80s. You got to check out his videos at drlife.com, at drlife.com. And we'll be back in just another second to talk about premature ejaculation. All right, Dr. Life, we're going to hit this topic of premature ejaculation. And I know it's a really big issue for men, and it's a very difficult one to sometimes overcome. Will you talk about how you address and help patients with premature ejaculation?
Well, premature ejaculation is a problem. And so I really promote for good sexual health and erectile performance. I encourage men to start learning how to do Kegel exercises. This is really familiar with women. They're taught by their gynecologists and obstetricians to do Kegels. Well, it works really well for men too. And so I teach them how to contract their pubococcygeal muscles, and then I talk to them about the different kinds of Kegels, the slow Kegels, the fast Kegels, the big move Kegels, and then the fluttering Kegels. I talk about these in my book. This is an exercise.
Through that, that Kegel, that men's Kegel exercises. Okay, teach me how to do it if I was a guy.
All right, so I guess one of the best ways to know what muscles to contract would be to, when a guy's urinating, to stop the stream and start the stream. Just stop it. In order to stop it, you need to contract your pubococcygeal muscles. You need to do a Kegel exercise. And to start it up, you relax those muscles. And that's one way to really know what muscles you need to work on. Another way is to walk into the Pacific Ocean about this time of year with your bathing suit on, and walk in and get deeper and deeper, and then all of a sudden you'll realize what your Kegel muscles are doing.
Okay, I'm having a good visual there. Thank you.
And Kegel exercises, you can exercise when no one knows it. You can be sitting in a meeting.
I don't know if you could tell, but I was doing mine.
Rip off a bunch of Kegels. You can do, and at first it's really hard to do more than 2 or 3 reps. But then as you get good at it, you can do repeats. You can do 10, 12, 15 contractions. And you can just be sitting there pretending you're enjoying this meeting, and you can rip off a whole series of Kegels. You can be sitting at a traffic light and do the same. It's an exercise that you can really work on without anyone knowing it. And so I encourage my patients to learn how to do that, and then this not only helps with premature ejaculations, it helps with everything. It helps with orgasm. A guy's orgasm is much more powerful if he has well-developed pubococcygeal muscles. And so it's a win-win for women and men to really know how to work those muscles and build those muscles up.
Mm-hmm. Okay, so what else can help with premature ejaculation? Definitely the Kegel exercises, optimizing their testosterone, not too high, not too low as well, correct?
That's correct. And then working with their partner. I mean, it's a team effort, and same with impotence. I mean, if a guy is unable to get an erection, many times it's just because he's nervous or he's got some psychological issues. So if he works with his partner and they work together on it really helps. Helps correct premature ejaculation and helps promote an orgasm and a good erect penis.
All right, and
then if all that fails, a guy needs to go to the urologist that deals with this, and so he should make an appointment, and he should ask prior to the appointment if this particular urologist deals with this and knows how to treat this.
that's a good point, because they don't all know how to address this issue, and it's important. And just from the sexual health side, using constrictors around the penis, at the base of the penis, that definitely helps to maintain the blood flow. Okay, I just have a curiosity question, Jeff. How old is the oldest person that's come in to see you, had erectile issues, and then you were able to help them reverse that and have spontaneous erections again?
I think I have an 89-year-old patient that is sexually active.
Glad to hear it.
Sexually active. I have several in their early 80s, and then a whole bunch in their 70s, 60s, 50s, and 40s. ED is a big problem that guys don't like to talk about. They don't want to admit it.
That's so true.
But medications can be a cause of it. Psychosocial issues, political situations can suck the energy right out of you, as we all know. And then you got this COVID virus going on that really has crippled everyone's ability to move around. So all these things play into it. And I think talking about this with your significant other and having open conversations with that person really helps.
Well, that's going to... I agree. And we actually have a special with you in the Girlfriend Doctor Club, and we're going to talk about how to bring up this subject in a very loving way with our partner, because there's no area, male or female, that is more vulnerable than our sexual health and our sexual intimacy and pleasure. I mean, this is such a vulnerable area for couples. So I want to bring you inside the Girlfriend Doctor Club for a special exclusive on how we talk about this. So I want to thank you. We've got some great tips in our earlier episode on erectile dysfunction, and now on premature ejaculation. And the fact that we are talking about this, I mean, this is such good stuff. This is so important. I thank you for the work you do, and I look forward to seeing you inside the Girlfriend Doctor Club. And for our audience, Dr. Jeffry Life, in practice and MD, been in clinical medicine for 50 years. Check out his information. He, again, still sees patients at drlife.com. And you got to watch his videos, because, I mean, they are just incredible, and you see what he's doing. And we sat on a scientific board together, and one time I was like, Jeff, can I just touch your abs? Are they photoshopped? And he's like, yeah, go ahead, and touched your abs. I'm like, oh my God, just incredible abs. So I love telling that story. Anyway, all right. Thank you all for being here on the Girlfriend Doctor show, and I look forward to seeing you next time. More to come. Be sure to join us in the Girlfriend Doctor Clubhouse, where we get this uncensored content with these amazing experts. All right, see you on the inside.